What tests help detect COVID-19? Currently, the CDC, Centers for Disease Control and Prevention, has developed a new set of laboratory test kits for use in laboratory testing of patients with severe coronavirus 2 respiratory syndrome (SARS-CoV-2) caused by COVID-19. The kit with the name, Coronavirus Diagnostic Kit for New Strain 2019 nCoV by Real Time RT-PCR technique of Centers for Disease Control and Prevention, CDC. The kit will work with real-time PCR system Biosystems 7500 Fast DX and SDS 1.4. This test will combine with samples collected in upper and lower respiratory tract fluid from those who meet the CDC criteria for the COVID-19 test. Eligible CDC laboratories in the United States will use these test kits, or CLIA-certified laboratories to perform highly complex tests. After that, we'll move to the international laboratories eligible for these test suites. For example, the World Health Organization's Global Influenza Response System Laboratories (WHO). Testing will not be available at U.S. hospitals or other care facilities. The test kit will be distributed through IRR International. On February 3, 2020, the CDC submitted a patent application for the kit (EUA) to the U.S. Food and Drug Administration (FDA) to expedite the licensing of the kit in the U.S. The U.S. Secretary of Health has declared the SARS-CoV-2 virus a public health emergency. The FDA issued the right to use the kit on February 4, 2020. Later, the IRR began distributing test kits to the states. However, the voluntary production of one of the kit components in the laboratory will not guarantee the accuracy of the kit. CDC will produce kit components with quality control measures, and CDC will send new test kits to laboratories when needed. CDC is still continuing to conduct initial testing of the test kit. More information. COVID-19 China-originated virus in December 2019. Characteristics and formation of coronavirus family, COVID-19. COVID-19 Coronavirus 2019 Infectious Disease Group A. Guidance on medical isolation at home and in the room to prevent acute respiratory infections caused by coronavirus, COVID-19. Instructions on how to prevent disease in 2019 nCoV, COVID-19. Basic safeguards to prevent 2019 nCoV, COVID-19. Does COVID-19 spread from pregnant to unborn baby? Refer to 247naturalhealthtricks.com. Item samples are used to perform COVID-19 test. The respiratory specimens include nasopharyngeal suction or throat wash, bronchial wash, tracheal aspiration and sputum. Specimens only collect on swabs, cotton swabs of synthetic material such as polyester or Dacron with aluminum or plastic shafts. Do not accept gauze with calcium albatate or cotton with a wooden shaft. Cirrus. Medical personnel should wear appropriate personal protective equipment, e.g. gown, gloves, eye protection, when working with patient samples. Handling of samples in the biosafety cabinet of Level 2 and in compliance with the instructions of Biosafety Level 2 or higher. How to handle and store sample items, COVID-19. Samples can be stored at 4 degrees Celsius for up to 72 hours after collection. If the specimen cannot be treated immediately, store it at -70 degrees Celsius or lower. Virus RNA extracted from specimens should be stored at -70 degrees Celsius or lower. Rejection and remove of patient samples. Samples are not kept at 2 to 4 degrees Celsius for 4 days or not frozen at -70 degrees Celsius or below. The labeling or documentation of patient samples is incomplete. Sample does not match. Insufficient sample volume. Quality control procedure for COVID-19 tests. Because of the high sensitivity of RT-PCR, these tests must follow strict quality control and quality assurance procedures. In particular, following these guidelines will help minimize the risk of false positive amplification. Therefore, laboratory personnel must have specialized and familiar training with the methods and tools to perform the tests. Maintain separate areas and specialized equipment, e.g. pipettes, centrifuges, and supplies, e.g. centrifuge tubes, pipette tips, robes and gloves, for test preparation, also like viral RNA extraction. Workflow must always be arranged from clean area to dirty area. Use clean gowns and disposable non-powdered gloves during the test. Change gloves when suspected contamination. Store test chemicals such as primers, probes and synthetic enzymes at the appropriate temperature. Do not use an expired kit. Always cap chemical tubes and reaction tubes. Clean and disinfect surface. Do not bring materials into the preparation area for testing, such as viral RNA or PCR products. Only use a pipette tip with an anti-aerosol filter. Use only PCR sheets with lids, not film coverings. Thank for watching. Do not like, share and subscribe to watch new videos. Wish you and your family peace.